What is the pancreas? The medical truth nobody tells you. Today we are going to solve this mystery. First, the direct truth. The term pancreas does not exist in the official medical dictionaries of Western medicine. You will not find it in anatomy atlases, physiology manuals, or scientific databases like PubMed whose names begin with pan or pang and whose ending could be phonetically associated with grias. Pan, in Greek means all, and kreas, derives from krais, flesh, referring to its glandular appearance. It may simply be a pronunciation or writing mistake. The truth? No. Does it really exist in Western medicine? Subscribe and comment behind the disease there is more. Soledad del Prado. So, where does this word come from? Most likely, it is a distortion, a spelling mistake, or a transliteration of another concept. And here is the good news. Even though the word does not exist, what you probably want to understand does exist, and it is very important for your health. In this video, we are going to explore the 4 systems of the human body that could be behind the term pancreas. We will explain, in a simple and visual way, what they do in your body when they are healthy, why they deteriorate, what diseases they cause when they fail, all of this without complicated words. Let's begin. The first and most likely candidate is the pancreas. It is an elongated gland, about the size of a hand, hidden behind your stomach. Even though you cannot see it, it works 24 hours a day to keep you energized and properly digesting food. Imagine the pancreas as a factory with 2 departments. Department 1, digestion. It produces special juices, full of enzymes that break down what you eat, fats, proteins, and sugars. Without them, your body could not absorb nutrients. Department 2, sugar control. This is where the famous insulin and glucagon work. They are like traffic guards. Insulin lowers sugar when it gets too high, after eating. Glucagon raises sugar when it gets too low, between meals or during exercise. Together, they keep your energy stable. They are essential for your brain and muscles to function properly. Mechanisms of deterioration, causes of damage. Why does the pancreas become damaged? The most common causes are gallstones, small stones that block the pancreatic ducts, causing acute inflammation. Excess alcohol irritates and damages the enzyme-producing cells, leading to chronic inflammation. Autoimmune attack. The body's defense system becomes confused and mistakenly attacks the cells that produce insulin. Insulin resistance. When the body's cells stop listening to insulin, the pancreas works excessively until it becomes exhausted. Specific associated diseases. When the pancreas fails, very well-known diseases appear. Type 1 diabetes mellitus. The body stops producing insulin. Requires daily injections. Type 2 diabetes mellitus. The body does not respond properly to insulin. Managed with diet, exercise, and medication. Acute pancreatitis, sudden and painful inflammation. It can become serious if not treated. Chronic pancreatitis, permanent damage that affects digestion and sugar control. Key fact: the pancreas is the only organ that, when its endocrine function, insulin production, is damaged, does not completely regenerate. Candidate 2, The parathyroid glands. The second candidate is the parathyroid glands. These are 4 tiny glands the size of a grain of rice, attached to the thyroid in your neck. Although they are tiny, they have enormous power. They control calcium in your body. Normal physiological function. The job is to keep calcium balanced, like an orchestra conductor. In the bones, they release calcium when the blood needs it. In the blood, they raise calcium levels if they are low, so your muscles, nerves, and heart can function properly. In the brain, calcium is essential for neurons to communicate. They do this through a hormone called PTH, parathyroid hormone, which acts like an intelligent messenger. Mechanisms of deterioration. These glands can be damaged by thyroid surgery. Sometimes they are accidentally removed during an operation. Autoimmune diseases. The body mistakenly attacks the parathyroids. Benign tumors. Excessive growth may cause them to produce too much PTH. Specific associated diseases. Hand cramps, fragile bones, fatigue. When they fail, 2 opposite conditions appear: hypercalcemia, low calcium, muscle cramps, tingling in the hands and mouth. In severe cases, spasms or seizures. Hypercalcemia, high calcium, extreme fatigue, confusion, nausea, kidney damage and weak bones over time. Key fact: a simple blood test can measure calcium and PTH levels to diagnose these problems. The pituitary gland. The third candidate is the pituitary gland, also called the master gland. It is the size of a pea and lives at the base of your brain. Although it is small, it directs almost all the other glands in the body. Normal physiological function: imagine the pituitary gland as the conductor of a large hormonal orchestra. Growth hormone helps you grow and repair tissues. TSH tells the thyroid to regulate your metabolism. ACTH signals the adrenal glands to manage stress. FSH and LH control fertility and sex hormones. Prolactin and oxytocin, essential for breastfeeding and emotional bonding. Without it, your body would lose its rhythm. Mechanisms of deterioration: the most common causes of damage are benign tumors, adenomas. They grow slowly and can compress the gland. Head trauma, accidents that damage the base of the brain. Hemorrhages, such as Sheehan syndrome, after childbirth with severe blood loss. Autoimmune diseases, rare but possible. Specific associated diseases: visual symptoms, short stature, fatigue, weight changes, infertility. When the pituitary fails, it can cause panhypopituitarism, deficiency of all hormones. Symptoms: extreme fatigue, weight loss, low blood pressure, infertility. Acromegaly, excess growth hormone in adults. Large hands and feet, coarse facial features. Cushing's syndrome, excess cortisol. Weight gain in the trunk, round face, fragile skin. Key fact: many of these conditions are treated by replacing the missing hormones with pills or injections. Angiogenesis: the fourth candidate is not an organ, but a process. Angiogenesis. It means the birth of new blood vessels. It is as if your body builds new highways to carry blood where it is needed. Normal physiological function. Angiogenesis is vital in normal situations: during pregnancy, to nourish the developing baby, while healing a wound, to bring nutrients and repair cells, during the menstrual cycle, to prepare the uterus each month. It is activated by chemical signals, especially one called VEGF, vascular endothelial growth factor. Mechanisms of deterioration: the problem appears when this process becomes uncontrolled. Too much angiogenesis: tumors use it to grow and spread, creating chaotic vessels that feed them. Too little angiogenesis: in diseases such as diabetes or arterial disease, the body cannot create new vessels to repair damaged tissues. Specific associated diseases. Unbalanced angiogenesis is at the center of cancer. Tumors need blood vessels to grow. That is why some treatments cut off the supply by blocking angiogenesis. Cardiovascular diseases, when the heart does not receive enough blood due to lack of new vessels. Diabetic retinopathy, abnormal vessels in the retina that can cause blindness. Key fact: research into angiogenesis has led to medications that can turn off or turn on this process as needed. The 4 systems studied: pancreas, parathyroids, pituitary gland, angiogenesis, with a green check mark over each one. Hopeful and empowering tone. So, what did we learn today? Pancreas is not a recognized medical term, but it probably refers to one of these 4 vital systems. The pancreas is the strongest candidate because of its similar sound and its central role in energy and digestion. Each system has a clear function, deteriorates for specific reasons, and causes well-defined diseases. Western medicine does not guess, it studies, validates, and names things precisely. That is why, when a term does not appear, it is a sign to investigate further. If this video helped clarify your doubts, share it with someone who could also benefit from it. And if you have more questions about how your body works, leave them in the comments. Together, we continue learning.